Hey everyone, thank you so much for joining us today. We're so excited. This event has been 2 years in the making. We've been looking forward to inviting students and educators and community groups across the nation to join our student movement launch ever since we learned about social prescribing. And we'd love to kick off our event with an amazing speaker, Dan Morse, co-founder of Social Prescribing USA and incredible mentor to our group and to each of us individually, to introduce everyone to the concept of social prescribing and why it means so much to so many people. As we're speaking, feel free to take a screenshot or keep using this code to leave questions. We're going to keep all those questions, try and answer them as we go along or later on, and send those questions out later. Dan, would you like to take the stage?
Absolutely. Hello, everybody. It's wonderful to meet you, see some familiar faces, many new faces. So for the past couple of years, I've been working with a bunch of individuals at organizations, many of them featured here, to advance a new way of creating health called social prescribing. And I'll go into more details, but I'd figure to start, I'd love to hear from you, Rachel, if you could share the link in the chat. This is an interactive slide deck, so you can come in here and you can type and answer a question. So come into the slideshow. Oh, I might need to grant some permissions. Okay, cool. If you refresh, you can edit it. But come in here, and here's my question for you all. What are some ways we should change the US healthcare system? And you can also answer more broadly. I know there are many people who aren't in healthcare. More broadly, how should we improve the health of people in our country? You can write your answer in here. Promote more exercise, and then put your name in afterwards. See what people got. Seeing some good stuff. Hyperlocal healthcare access, amazing. We got a lot of accessibility here. Accessibility finance, community-driven, focus on prevention. Greater access to underserved communities, more equitable. And let's see some names on here. I'm seeing Jennifer's, Mindy, individualized healthcare, social determinants of health. Awesome. So all of these goals, I think it might actually be every single goal is actually touched upon in healthcare. In social prescribing. So, all of us here, we crave the ability to make an impact. We crave to embody the wellness and health aspirations that many of us are outlined, and many of us crave to be part of a team in something bigger than ourselves. And so what we invite you to here is to join a student-driven revolution in our healthcare system. And it's a revolution from what's wrong with you to what matters to you. It's a revolution from seeing problems to possibilities, from treating illness to inspiring health. And we've seen a similar student movement in the UK transform their healthcare system and education system. Hamaad is going to share his personal experience with that later on. And students like you are driving change in the US healthcare system today. Now, we need this change because America faces a bunch of silent crises. These numbers are pretty baffling. There are 32 million people depressed, 192 million people lonely, 100 million people obese, and 20 million people who are addicted in some way or another. And our pharmacological approaches have their limits. We aren't solving these effectively with just pills and procedures alone. We need something else. So how can we address this as a society? What will the next generation of solutions look like? And think about the last time you were experiencing joy, or the last time you felt truly alive. Chances are you were with people or doing something you love. And there's been some really fascinating research that has come out over the past 5 years that is changing the way we look at health. There was a review of 3,000 studies by the World Health Organization that showed that engaging in arts can improve your physical and mental health. There was a study of 13,000 people showing that you live longer if you volunteer. Very interesting. There are dozens of studies showing that if you engage in nature, it improves your health with as little as 10 minutes a day. And studies that have shown that People who feel purpose in their life have better health outcomes regardless of socioeconomic status. So these flourishing activities can be essential drivers of wellness. Now, there's been some other interesting research that's come out on the power of social groups to impact our health. Loneliness can have a negative health impact akin to smoking 15 cigarettes per day. And relationships are one of the biggest drivers of our health. And we also know that meeting people's basic needs is one of the most essential things to health and having everyone thrive. And so as we look at these things, flourishing activities, relationships, meeting basic needs, traditionally healthcare has not addressed these health creation activities. And a new chapter in our understanding of health is emerging. And it starts with a simple idea and a simple question. And that question is, what if doctors prescribed more than just pills? What if they prescribe those very activities that bolster health, access to arts, nature, volunteering, access to social services like food and housing assistance? This is social prescribing. So brief 1-minute video that I'll quickly show you, created in the UK that summarizes the practice. Let me quickly share and make sure that I'm sharing the audio so folks can see.
Many things affect your health and well-being. GPs tell us that a lot of people visit them feeling isolated, lonely, or stressed out by work, money, and housing problems. These are issues that can't be fixed by doctors and medicine alone. At its most basic, a social prescription offers the kind of help that doesn't come in a tube or a bottle. The idea behind social prescribing is to help you to have more control over your healthcare and find ways to manage your needs in a way that suits you. There are lots of different ways of providing social prescribing services. It often starts with a conversation, perhaps with a link worker, a support broker, or a community navigator. Whatever they are called, they are there to listen to you and put you in touch with whatever it is you might need in order to feel better. That might mean being introduced to a community group, a new activity, or a local club. It could be legal advice, volunteers to help around the house. It might just be information and guidance, a bit of inside knowledge on your situation and what local resources there are available. It could even be some support in how to create something new.
So social prescribing, I'll kind of summarize it again. To break it down, first is that a patient goes to the doctor and mentions they have moderate anxiety, loneliness, depression. And in our current systems, doctors will typically then prescribe medication or therapy. Many patients, though, are either resistant to drugs or on too many or looking for pharmacological alternatives. So instead, a doctor will refer them to a social prescribing link worker who can help them find a personalized activity or resource in their area, also known as a social prescription. And let me ask you a question. So everyone in the audience, think of your two friends who are the most different from each other. I'll give you 30 seconds to think of those two friends. Two friends that are most different from each other. Okay. Now, would you get them the same birthday present? Yes or no? No, you definitely wouldn't. They probably have totally different interests, right? So similarly, not everyone gets the same social prescription. It's not, okay, you all do arts, you all do volunteering. The link worker has a menu of 100 different local activities and resources. And with the patient, co-produce a social prescription that matches their interests. So Jamie might have loved playing trombone when he was young. And so they discovered that, the link worker discovers that and then connects him to a local music group. Or there might be another person who has an interest in tending plants and they'll get involved in a nature group. It's completely designed to that person's interest. Now, let me ask you another question. And I don't think that people can chat. Can they, Rachel? Or no? Okay. So I'll ask a question. Do you know anyone, or if you yourself, who has struggled with anxiety or depression? My guess is that probably some people have. Bless you if you and your network have not. But do you think it's easier or harder to engage in activities and social groups when you're depressed or anxious? I think for most people, it's a lot harder. So people who are lonely and depressed tend to be more reticent to connect with others. They need coaching to get over that hump and engage confidently. And a link worker can ask questions like, do you have any hesitations? What could you do to ensure you actually go to the event? Text them before and after to give them encouragement. So patients are going to these events. They're emerging from depression with more agency, more confidence, more tools to manage their own health. People are finding strength in community service, peace walking through pastures, calm and creative expression. The local community is enlivened with more relationships and activity. And the beautiful thing is that social groups have such an incredible power to reinforce health behavior. For example, if I wanted to exercise more, you could show me all of the best, most leading health behavior research. But the number one thing that will get me to exercise more is if a friend knocks at my door at 7 in the morning and drags me out to go for a run. What if our solution to our health was each other? What if health was not just found in pills, but in people, not only in procedures, but in purpose, not in addressing what is wrong with us, but building into what is right? And the most amazing part about social prescribing is that social prescribing is scaled nationally in the UK, and there are movements sprouting up in 23 other countries. You can go to any doctor in the UK and get a social prescription. And the most amazing thing about these movements is that many of them were started by students. Hamaad will share more on this later, but a British medical student, Bogdan Chivas, decided to start a student chapter network. And students across England rallied to raise awareness in their schools. And years later, now every medical school has a chapter. There were academic papers written about the students' ability to organize, and some even convinced their administration to integrate social prescribing into their curriculum. And now Hamaad, who is speaking with us later, has taken the baton. And today, there's a bunch of students, and we're kind of kicking it off. We're planting the seeds for US adoption. My work at Social Prescribing USA has been gathering a network of organizations and professionals eager to drive this movement forward. We've got a bunch of organizations launching pilots, exploring different ways of implementation. And they want to collaborate with you, invest in your generation that will be taking over the reins of the US healthcare system. And thankfully, in this webinar, you will hear from Maddie, Rachel, Sonia, Richard today, who have been planting the seeds for the US Student Network so that anybody can get involved and make a contribution. Everybody has value to bring. The US student movement has begun, and this webinar is not a conclusion. It is the start of a conversation, an exploration of how all of us can band together to shape the next generation of healthcare. And so what we're talking about here, social prescribing helps us heal people. It'll help you, other people take charge of their health. Heal society. Imagine 10 million more people volunteering, 10 million more people bridging social divides, getting involved in nature. It also heals a culture. Imagine a culture being pushed towards more kindness, altruism, purpose. People will proactively see new cures for their emotional woes. Their new medication will be community, altruistic care, purposeful activity, connection, resources outside of the clinic. And all of us will look back and think, I can't believe that in the 1900s, our concepts of health ended at nutrition, exercise, hygiene, and stress. So I'm going to pass it off to the Harvard students to share about their chapter.
Thank you so much, Dan. I always am inspired to hear you talk about social prescribing. And now we're going to get to talk a little bit more about work that sprung out of Harvard students interested in social prescribing and the movement going forward. So slides are all looking good. Oops, let's go back one. Sorry. Let's go back there. Great. So my name is Sonia Epstein. I am a student leader for the Harvard Undergraduate Initiative of Social Prescribing, Students for Social Prescribing. And I'm actually no longer a student at Harvard College. I graduated in May, but I'm here to talk a bit about why I got involved when I was a student, and more importantly, why I'm still here now. To do that, I thought I'd talk a little bit about this picture that I decided to put here. I found this kind of recently. It's a bit old. It's from my senior spring of high school. And I'm working on a big sort of culmination writing project that seniors had to work on. And as you can see, I'm having a lot of fun doing it. I love writing. I was having an incredible time just being able to sit there, work on something creative, reflective with a lot of friends. At that time, I thought I might be a writer, professional writer, when I, moved through my career. Things have changed since then. So just slide control issues. Now I work at Boston Children's Hospital. And this transition from the world of writing to the world of medicine, which is sort of where I want my career to continue evolving, wasn't really, in my mind, a big pivot. And I think a large part of that is explained by social prescribing and what social prescribing means to me. It really links those identities, I think, of that I have as a writer and as someone who wants to work in medicine. And I think that's because, as Dan was beginning to explain, social prescribing is really about systematizing a way for people to connect with the things that make them feel whole, whether it's creative writing, something else, art, nature, sports, resources that are provided by the community and voluntary sector. And it was just so intuitive to me as someone who derives a lot of joy and sense of well-being from things that aren't normally prescribed in a medical space, that social prescribing is still a really necessary part of our health system. People are happier and healthier when they have the opportunity to connect with things that matter to them. So I was midway through college when I learned about social prescribing through an internship opportunity at the National Academy of Social Prescribing in the UK. And that summer, I was working for what's called NASP with Rachel Chen, who you'll hear from next. And our project really was to create this student movement framework. As Dan was sort of beginning to explain, students were a huge part of the social prescribing movement in the UK, of bringing awareness to this movement, implementing curricula, convincing people who are already in the healthcare field that it was something necessary. And so we spoke with a number of those students who had been involved. We learned from them, and we sort of synthesized the knowledge that they had gained into this framework that we put together. In doing that, we were able to make connections with a lot of the students who are involved in social prescribing. Dan already mentioned Hamaad, you'll hear from him later. Those connections have been ones that we've maintained since that summer, and also connections that have continued to grow. So we're able to kind of launch this on an international stage with the World Health Innovation Summit. And I think on a sort of more granular and more important level, we've really been able to see how this framework was able to connect us with other students. So the student movement leaders in Canada recently told us that this was an important part of their launch in Canada. And now we're kind of learning from them as we establish our own student movement in the United States. So I think that it's really exciting to think back at this framework, which we began already a couple of years ago. It was never just an abstract exercise, but really preparation for what we're doing now and launching a student movement in the US. And I guess if I could share one thing that I think we all were learning from the process of putting that together, it's just that students have this incredibly powerful and unique opportunity being at the outset of our careers to think critically about what kind of social system or healthcare system we have, what we want it to look like, and to argue for change where we believe it's warranted. We're at this place in our lives where we can afford to challenge the status quo and build a system that is one we want to have in the future. So things are really picking up. The last thing I'll mention is just that in talking to so many students from around the world, it just is so clear that people from a variety of backgrounds find a place in this movement. And that really speaks to the way that social prescribing is individualized to people. You can be a computer scientist, a creative writer. This movement has a place for you in it. A lot of what I continue to do for the social prescribing movement involves my writing. So these things continue to be very connected for me. So with that, I will introduce Rachel. who worked on the student framework with me, and she'll tell you all about the work that she's continued to do in probably the most humble way possible, but it's incredible work. So let me just give Rachel control of the slides.
Thanks so much, Sonia. Hi, everyone. My name is Rachel Chen. I am a senior at Harvard College, and I'm also working on this really exciting pilot project at the Cleveland Clinic, delivering social prescribing for geriatric populations. So ever since I interned at the National Academy for Social Prescribing with Sonia, I've been really fixated on this question. How do we implement social prescribing in the US? We know this is tough. We don't have an NHS. We don't have a centralized healthcare system that can implement change from the top down. So what we're looking at today and in the past 2 years and moving forward is a cultural revolution, right? We're looking at a way to mobilize all kinds of parties and interested stakeholders from the public sector, private sector, students, academics, mentors, community organizations, volunteer associations, patient advocates. The list goes on because everyone does have a stake in it, but we have to unite if we want to bring it to the United States. So in an effort to get to know the landscape of stakeholders in the US, I worked on this piece mostly about the US student movement, or sorry, not student movement, the US movement at large for social prescribing, which ultimately I pitched to Time magazine and was published in Time Health Pro and online, and I believe circulated by the CDC at one point. So in the process of writing this, I had the amazing opportunity to speak with just the most amazing and inspired leaders across the US who are already doing social prescribing work, whether in an academic capacity or delivering it on the ground. And I wanted to highlight two folks who have become, or two organizations that have offered incredible support and mentorship to our growing movement and to me personally. So at CultureRx, they're delivering the first ever social prescribing pilot in the US. It's been several years now that they have delivered statewide social prescribing in Massachusetts, funded by Mass Cultural Council, offering activities ranging from a year-long family pass to the Arboretum, to community theater performances and art classes or dance classes. And they're connected through various types of clinical partners and patient populations, ranging from pediatrics to adults with disabilities. And so their incredible work is just so inspiring, and they've allowed students to get on board and support them in such a wonderful way that has continued to sustain my love for social prescribing. And in the process of writing this article, I also got to connect with Dr. Ardashir Hashmi at the Cleveland Clinic, who is the chair of the geriatric division and also of geriatric innovation. And during this interview, I was just so moved by his anecdotes of these patients he sees on a regular basis who get anxiety attacks or panic attacks when they remember how lonely they are, or live day to day feeling depressed and lonely in a way that the 20 plus pills and pharmaceutical tablets they get can't resolve. And so he's telling me, I would really like to do more social prescribing at the Cleveland Clinic, but I'm just one guy and I don't have a real infrastructure to do that. I don't have enough support or time. And I was saying, I got nothing going on this summer, Dr. Hashmi. What if I came down, hung out, saw what was up? And so what happened next is I went to the Cleveland Clinic and I got the opportunity to really push forward a pilot program with amazing support from Dan and from Dr. Hashmi and his entire team, building out both the infrastructure and the evaluative framework for a social prescribing pilot. So this is a twofold challenge, right? Because on the infrastructure side, it's amazing to hear from doctors that they want to provide social prescribing for their patients, but they are already overloaded. As I'm sure many of you who are medical students or medical professionals know, there's no space to go out of your way for a patient, even if you want to. And so part of my job was figuring out what is the most efficient referral process and partnership process that can take out all the friction in this workflow and make this as easy as possible for physicians. So that looked like talking to different community groups about what they need too, and talking to physicians and nurse practitioners in Dr. Hashmi's office about what would decrease the amount of friction in the process for them. I was talking to Assembly for the Arts, I was talking to Greater Cleveland Volunteers, I was talking to Benjamin Rose Institute on Aging and Holden Forest and Gardens. And together we've created this pilot program that hopefully will launch in the next year, delivering social prescribing to geriatric folks in Cleveland. Now, on the other side, I know several of you actually left this question early on in your sign up. How do we evaluate social prescribing? What does research for social prescribing look like? And that's something I really got to dive into over the summer as I was exploring, how do you capture a depression that never happened? How do you capture more meaning in someone's life? And I would love to chat more about that as well. So this was an incredible experience for me. And as I'm thinking about this, Dan is messaging me all of these amazing things that are happening on the national level. And the stage is really set for us to engage more students and bring more of our peers on board, which Maddie will tell you more about in a second.
Thank you for that wonderful intro, Rachel. My name is Maier, and I'm also a senior at Harvard College. And currently I'm the president of the Harvard Undergraduate Initiative of Students for Social Prescribing, or HISP. And if I'm being honest, I have much more than just that intro to thank Rachel for. She was actually my introduction to social prescribing and the reason why I'm here right now. And a little disclosure before we begin is that Rachel and I are roommates. And as you know, with your friends and your roommates, you hear about their projects and what they're interested in and their activities. And sometimes you feel a sense of obligation to go to said projects and activities. And so when Rachel peer pressured me into attending this webinar about social prescribing with the National Academy for Social Prescribing, I felt obligated to go. It was a small call. It was just me and Rachel and our mentor Bogdan. And even though I joined because Rachel was just so enthusiastic and because of that roommate obligation, by the end, Bogdan had convinced me that social prescribing was something that I needed to be a part of. And the fact that one little chat was powerful enough to bring me to London, that's Bogdan on the left, and then back to HISP, and now here with you all, I think is really, really amazing. And so I'm really grateful, Rachel, for you roping me into this movement. I think that my story also has the potential to become super common amongst students, because there's this generation that intuitively understands the principles of social prescribing because we grew up with them. We grew up understanding everything contributes to our health, from our stress to our diet to our social activity. And this is something that is super easy to talk to with students and super easy to connect with them. And we found that when we were growing our club here at Harvard, it was surprisingly easy, and we gathered students super, super quickly that already agreed with these basic underlying social prescribing principles. And maybe they didn't have the language to talk about social prescribing, or they hadn't envisioned this big, large-scale implementation of it. But as one of our members said, the most accurate way to express how I feel about social prescribing is, wow, there's a name for something I'm passionate about. And this same member actually has run a nonprofit for years, doing what could be called social prescribing with the scleroderma community. And so with all of these members in mind, their interests, their principles, our club has come up with two aims. The first of which is to give our members language to advocate for social prescribing at a large scale. And we also want to give them the opportunity to interact with as many existing community groups that are already doing amazing work. And we have a lot of members. Some of them just come to general meetings, they want information, but for those that want to be more involved, we have these things called working groups, which we've already had 12 members come through, and they're working with all sorts of organizations with amazing mentors, with arts organizations, cultural councils, SPUSA, nature orgs, and they're doing really, really cool work, and they seem to be really excited about the work that they're doing, because they're helping design the social prescribing pilots, they're creating implementation guides, and they're discovering the best practices for new community groups, new policymakers moving forward. And I think that is really important, because the work that they are doing right now will have a lasting impact on the movement going forward, and it's going to be read for years to come. And so as a club, I think we've grown rather quickly and we've achieved a lot. And we have had amazing founders like Rachel and Sonia that put structures in place that allowed this growth to happen. But it was actually the members that allowed us to grow. Because for busy college students, they have consistently surpassed our expectations. And we're so proud of them every day. They come with new questions and new things that they want to do. And they're really the ones that have shaped this club. And it's honestly crazy to me that they bought in so quickly. And that's also why this time right now is so special for students. It's the perfect environment, not just at Harvard, but across the country, for students to get involved and to lead a movement. We also know that students are more powerful than you might think. We have numbers, we have the connection to our community around our campuses, we have the proximity to amazing mentors, and we have the ability to gather a lot of like-minded people in one place. And one person that I know that understands the power of this position is actually our partner at Columbia, Richard B. Crawford. And Richard's a master's student in human nutrition and is the advocacy chair of the Global Health Organization at Columbia University, Vaglos College of Physicians and Surgeons. And he joined the movement in 2022, but he's been doing some really amazing work to launch the Social Prescribing Student Initiative within the GHO. He's been working on some really amazing projects, and I'm excited to let him take the stage and tell you about what he's been up to.
Thank you, Mazzy, for this beautiful introduction. I will add to it for the students for whom it is relevant that I went to college to the University of Southern California and just graduated in 2022. Learned about social prescribing in the past fall and have worked ever since to comprehend what it is and deepen myself into the movement. So it all began when a fellow student at the College of Physicians and Surgeons, who happened to be a medical student, introduced me to Bogdan. And I just got in touch with him, found out he wanted to come to New York and speak, so I hosted him. October 2022, he comes. Many different students attend, medical students, master's students, even undergrads, people from the other campus. Some people have actually nothing to do with healthcare. They all convene, and he tells us about these wonderful experiences of his. And this could serve as a model, potentially, to stir new student interest in new campus chapters. He engaged students with accessible health dilemmas, effectively establishing context that gave rise eventually to social prescribing practices. He described the theory briefly, but mostly illustrated his success stories, such as with this elderly woman I still recall who had her loneliness cured by joining a dance workshop. And actually, to quote the famous singer, found love in a hopeless place. And so some of these stories were the main captivating factors for me to continue this work, but also got interest from other students. I do have to confess that the movement is still young. Within Columbia, as I understand that on either campus, nobody had ever heard of it. But Bogdan did float opportunities for students to delve deeper into the social prescribing world. I happened to take advantage of that opportunity earlier this month. We'll hear about this in a couple of slides. But the next step, as we see in the next slide, consists in better understanding what social prescribing is all about. There's a learning process as well as an experience that I'd like to share with you. When you have to begin on your new campus, the work from scratch, there's a learning process about really understanding the theory so you can re-explain it to others. People are not going to be familiar with it, are going to be attempting to draw parallels with a wide variety of concepts they've heard themselves. Social determinants of health, link workers being the same thing as social workers, are just a few examples. you start thinking about also how to implement these things beyond just purely raising awareness. As raising awareness can certainly cause people to affirm their agreement, their consent, their sympathy for what you advocate for. But then they wonder what happens as a result of it. These are beautiful ideas and I'm all for it, but what do we do? And seeking to implement, to build, and eventually implement pilots within the local community seem to be one of the main keys that can stir the greatest amount of interest. At least that's what has happened in the Washington Heights community, which is where the Columbia University Medical Center is situated. Contacting people who are willing to host these services, who are willing to refer, and these people would be the doctors and the healthcare providers, refer their patients, finding the venues, coordinating the schedules are all a process of trial and error that demand resilient outreach, but also continuous networking from one person to the next. It will be difficult, it will be challenging. There is no way to sugarcoat it, but every single person you come across, as you attempt to ask questions, ask them to refer you to the right person, you will learn something from them. You will keep them as you go along, maybe as mentors. Maybe what they do, what they specialize in will serve to complete the puzzle later on in the process. And eventually, for me, that has resulted in continuously working on a pilot that I call the Geriatric Health and Healing Arts Initiative, that's included within the social prescribing initiative of my student-run organization. And that is still a continuously evolving process as we're trying to get patients to come to a senior center and trying to recruit artists to hold different artistic workshops. And there's these different stakeholders, these actors that need to be coordinated, these schedules that need to align, and these people that need to agree based on financial restrictions, time restrictions, interest, cultural and linguistic barriers of who is going to teach in what language, who's going to animate or entertain these sessions in a way that will be of interest to the clientele, so to call the patients. The other aspect of the implementation also orients itself around raising awareness within the student bodies and the educational institutions. We have also coordinated in that respect with Bogdan and a couple of other actors, advocacy toward curricular change, mirroring the model of the United Kingdom. I have been, for example, in touch with the chief, I guess, or director of my program to attempt within the world of nutrition to incorporate social prescribing. The question that arises is, how do we do it? How do we sell it? How do we modify existing infrastructures? How do we propose opportunities for students to learn more? And all of these come together in a very progressive manner, and will certainly emulate that model in new campuses as new student chapters get started. But the discussions are continuous and they're collaborative, and it's really this model of co-creation with the faculty, with the students, with the community organizers that will shape eventually what is being said and built into these curricula, these main awareness raising tools. So as I mentioned earlier, I took advantage of the Bogdan-sanctioned learning opportunity about social prescribing. Just 10 days ago, I was in Europe, in London, and Hamaad can actually testify to it, as he is in one of the pictures to the left, Dan as well. The internship that all my Harvard colleagues attended and went through is one I did earlier this month and is still continuous. I'm currently in the remote portion. It was mainly oriented around the conference, the social prescribing show, that took place over one day, and the next day, the implementation of a retreat to a relatively rural area not too far. The first day was oriented around hosting a bunch of speakers, as well as an international coalition of stakeholders, of funders, of government officials who wanted to learn about social prescribing or who wanted to teach and really exchange ideas, sit down in breakout rooms and share solutions to the issues of our contemporary health system state. And we can see some of the pictures. So on the left, I was with Hamaad and Dan. It was toward the end of the first day when we were listening to different panelists who were in the city government of London, but also high-ranking officials throughout the NHS. Some of these individuals can be seen on the upper central picture, and on the right is also a picture of the South Bank Center, which is the HQ of the National Academy for Social Prescribing. A very beautiful place, the largest artistic venue of Europe, where a lot of pilots occur and are in collaboration with the National Opera, with community organizations. There's even a community gardening activity that takes place on its rooftop. And all of it really comes together as we're trying to teach and exchange ideas with increasingly new people who can implement it in their own countries. And briefly, the second day of the main conference was around a retreat at Bromley by Both Center, which is a senior center where all of the principles discussed by Dan and my Harvard colleagues were implemented in a centralized way and has been taking place unraveling over the past 30 to 40 years. And the Bromley by Bow is actually one of the birthplaces of social prescribing. And so the deliverables and the projects I have been working on as a result of this internship, and I'm still continuously working on, are some journalistic articles that we're looking to publish in different media, including university-wide media, as well as academic articles that hopefully will be published in different journals throughout the US, UK, and worldwide. So just to conclude very quickly, the future directions of our work at Columbia next month, and all of you are invited. We are having the first ever New York City social prescribing convening at the Columbia University Medical Center. If you are coming to New York, if you have the possibility or the desire to come to New York, you can learn, network, and possibly even contribute to writing a report about everything that we all learn collectively from each other and build a template for citywide implementation across the nation. We're also exploring the building of additional pilots with Carnegie Halls, Lullaby projects, and additional childhood programs, local Brooklyn Nature Walk pilots for patients with dementia. And who knows, the possibilities are endless. Maybe we can all collaborate with each other to build an internship for social prescribing nationwide in the United States of America. And with this in mind, I hand the stage over to my British colleague, Hamaad, a medical student who has been very successful, has done wonderful work in social prescribing. I was honored to meet him last month, and I will hand the stage over to him.
Brilliant. Thank you so much, Richard. And ladies and gentlemen, it's an absolute pleasure to speak here, and to stay true to my British persona, I'm going to be a bit serious, if I may. Like I said, it's truly a delight to speak to you all at the launch of the US Social Prescribing Student Movement, and also to talk of some of the success we've experienced with our student movement here in the UK. We've already heard the importance, value, and purpose of social prescribing, but I would also like to express its urgency. There is a huge, gaping, and glaring paradox of modern medicine. The paradox of modern medicine is that we live in an age with more medicines, more therapies, and yet also more illness. Now, if medical drugs were designed to revive, restore, and renew good health, we should all be experiencing an unprecedented level of good health across our societies. Yet, at this time of the greatest scientific and medical understanding, it seems ever harder to attain good health, good well-being, and good nutrition. So much so that now 70% of you Americans here are on prescription drugs. That is the paradox of modern medicine. It's through movements of social prescribing that we're finally understanding, and this is the crux of why we're really all here today, that though illness is a medical problem, it requires more than a medical solution. The US, like in the UK, has an industrialized system of sick care, not healthcare. We admit the sick, we tend to the sick, we care for and heal the sick. And when we're done, we put our patients back out into the environment that caused them the illness and sickness in the very first place. It's a cyclical and fragmented acute sick care system. Our health systems are designed to respond to crises, but they're not developed with the vision of health creation and disease prevention. The hope for the future with the UK Social Prescribing Student Champion Scheme, which is what I'm representing here today, is to develop a true national health service. And social prescribing does just that. It's about health creation and disease prevention. It's about empowering and enabling people from becoming health consumers to being health producers. It's about bringing health into your health system and putting care back into your health care. Now, the National Social Prescribing Student Champion Scheme was set up here in the UK by medical students in 2016. And since then, we've had more than 350 champions across the UK engaged with over 20,000 medical students, allied health professionals, young doctors, and trainees. We're spreading the word about social prescribing and helping to ensure that this is now becoming part of the curricula that is being taught at universities across the UK. And we have achieved just that. Now, all medical schools in the UK, we're proud to say and represent, are offering teaching on social prescribing, which is a stellar achievement that we hope the US will shortly follow up afterwards as well. And the National Academy for Social Prescribing also now offers bursaries to our 23 student championship schemes. And this helps students raise awareness about the benefits of social prescribing at their universities and also connect with their local communities with a lot of their social prescription programs, some of which you've heard today in examples with the US, but also to run peer-to-peer learning and teaching sessions. We're also very proud to say that this scheme now includes students training to be not just doctors, but nurses, midwives, and allied health professions, such as occupational therapists, pharmacists, speech and language therapists, dietitians, radiographers, and physiotherapists. Ladies and gentlemen, I'd like to end on this. Current health education informs future clinical practice. If we want cultural systemic change in our health system, it has to start with you. We know that health exists beyond the membrane of our biology. Health is promoted and destroyed in our houses, in our communities, in our social lifestyles, in poverties and beyond. So when you will join the US Social Prescribing Student Movement today, know that you'll be taking part of a movement that's advocating for a better health system for your patients, but also for your invisible patients. Patients who we will never get to see because they don't have the privilege to even come to the clinics. Patients who don't have the privilege to navigate their health systems, communicate their stresses or concerns. These are people who are the most dispossessed, disregarded, and disenfranchised. And by working at the community level, social prescribing makes sure that as our communities thrive, our most vulnerable populations do too. And that's what you're being a part of here today. I'm excited about the developments of social prescribing amongst the students in the US, and I want to extend my congratulations to HISP, to Rachel, Sonia, Dan, Maddie, Richard, and the wider team, but also to you all here in attendance today too, because it's your presence and enthusiasm that's ensuring that you're ever ready to improve and better the health and well-being for all. And that is a true social justice cause that you should all be proud of. So thank you so much.
Thank you so much, Hamaad. Let me just pull up my screen one more time. It's always so amazing to hear from you and from the UK, always taking inspiration from the incredible success you've had across the pond. So at this point, you heard the man. There's so much that we can do together if we unite, whether you're a student, educator, or community organization, or just an interested person. You have so much to contribute to this movement. And we would like to invite you to join. So if you're a student, we need you. We know you're out there. We know you care about these principles as much as we do. We know that you're looking for a like-minded community to share a team and a mission together. And we want to be that team for you. Please get in touch with us after. We'll put a link up for follow-up so you can officially join and come to future meetings. If you're an educator, we need mentors and allies. We need projects. We would love to hear what you're up to and what your interest in academic mission is so that we can connect students to you and you can join our larger network in the student movement. And if you're a community organization leader, first of all, thank you so much for the amazing work you're already doing to further social prescribing. We would love to send students your way to help support you in whatever work you're currently pursuing so that we can learn from you and you can go further with our help.
For students and educators, we just wanted to show you a little bit about what we've been doing besides this webinar. We've made this booklet, which we call a university chapter playbook, where if you're so inclined, you really, really want to start a movement in your college campus, we put together all of the things that we learned from starting HISP and from Hamaad's expertise and the Canadians. And we put it all together in a booklet, and we would love to show it to you if this is something that you want to do.
Our first meeting as a larger group is going to be next Monday, April 4th at 8 p.m. Eastern time, which will be 5 p.m. Pacific time. We tried to just pick a time that could work for all time zones across America, but if that doesn't work for you, please still fill out this form, stay involved. We'll try and rotate the times that we meet so that no one gets excluded too often just based on timing. This link will show up again on the next slide, so don't worry.
And so right now we're going to have a few minutes for some questions. I'm going to put the Menti board back up, and we'll also answer the questions that are in the Q&A if we have the time. But if you have individual questions or something that's a little bit longer, please feel free to reach out to hisp.info@gmail.com, or anyone on this call is really, really excited to hear from you. And even if you don't know who to send your question to, if you send it to us, we can redirect you. And if you want to stay involved, please fill out this form. And this is for everyone, anyone that's on the call, not just students. And so I'll toss that back up.
I'll also drop it in the chat. Please fill out the form. We would love to stay in touch. And when Maddie says we will redirect you, we will get on a call with you. We will get whoever you want on a call with you. We just want to hang out and talk to you and hear about your interest in social prescribing. Feel free to take a screenshot of this so you have all the information. And the Menti board will also be sent out to you. Let me drop the bit.ly for the follow-up in the chat so everyone has that there as well.
Also, if I may add very quickly, as I mentioned, there is going to be a conference or convening next month in New York, specifically at Columbia. If you guys are interested in attending to learn more, the morning session from 10 to 11:30 a.m. is going to be the one designed for students. So on that link that they have shared, also do mention your interest. And I guess my Harvard colleagues will connect because they're all coming, I believe, or at least most of them are coming. And so they will put you in touch with me, with Dan, with the organizers, and we can get you guys to come.
Okay. Rachel, do you see any questions you'd like to tackle, or Dan even?
All of them. What role do non-pre-med students play?
I love that question.
So much. The movement needs people and support from all angles. And I think Sonia is a great example of somebody who didn't come in thinking she was going to be pre-med or pre-health in any way, but has incredible writing skills that we continually take advantage of because she writes so compellingly, and we need so much material to get the word out. But other than that, Dan and I were just talking about how we'd love to set up one project for CS students who have coding skills, because we need back-end databases of information for grants and for internships, and would just love more tools and resources on the tech side as well. And if you have econ insight or financial skills or all of these, any academic skill or knowledge base you have is going to factor into this, because social prescribing is such a complex problem if we want to bring it to the US. You have certainly something to add.
I love how some of these, can I add something? I just
Yeah.
love how some of these questions are, how there's so much crosstalk between them. How can community organizations who work directly with the elderly play a role? I would love for you to get in touch with the person writing to the left of you. How do I begin a student chapter at my university? It's when we have these people from different spheres interacting with each other, students who want to do the work of figuring out how to, make these connections, connecting with organizations that are ready and willing, but perhaps don't necessarily have the connections to patients' medical systems yet. It's when all of these people are brought together and bridges can be formed that social prescribing starts to really be a reality.
I'm going to tie two questions together as well. How do I begin a student chapter at my university? And how can high school students contribute to the US social prescribing student movement? It looks the same wherever you are, because the process of starting a local social prescribing movement or group is just see who's interested, see who already feels like they resonate with the principles, see who your mentors could be and your resources around you are, what potential opportunities there are to connect with your local community, and then take that and run with it. Once people have interests, passions, and are talking to each other, something magical is bound to happen. And specifically, if you want the written resource that we've prepared, the playbook for university chapters, we're happy to send that out to you. We can also, it says university, but it can apply to high school. It can even apply to middle school. You can contribute in whatever local setting you are, because the minute you start talking about it and thinking about it, you're already making a difference.
So I was hoping to respond, if possible, to one question that just popped up right there. How can local news organizations contribute? Are there opportunities to work with students to spread solutions, journalism content? So this is something I've explored a little bit, and definitely one thing, if you're a college student, that you can do is go through the journalism school, if you have one, or the journalism majors, or any school media. We have, for example, the Columbia Magazine, we have the Spectator, which, there's a wide variety of school-wide media. That's number one. Number two, these professors who teach journalism, they have a past, they have a biography. Maybe they can connect you to some of the local organizations. If you strike the jackpot, maybe they'll connect you to CNN or MSNBC, but let's think small first. You can also just reach out to some of these small organizations yourself. That's what I did when I was in college, trying to spread the word about a club I had created that has nothing to do with social prescribing. So of course it's less likely to succeed statistically if you just cold email a bunch of different individuals, but always try to work through your networks, as there's a greater likelihood to obtain a response and to be bestowed credibility upon by whoever has the power to write the content and spread the word.
I'll just add real quick. I've been compiling a list of organizations implementing social prescribing in the US. There's about 30. The list kind of keeps growing, and I'm happy to connect any journalist to that list to find interview subjects.
For whoever asked, would love to learn about the research process and how people can get involved. That's essentially what our working groups at HISP look like. Folks going to specifically help with the research process or an implementation process with a specific community org, so you know that your work is being directly useful and not just busy work that someone's created for you as an intern. This is a model that we'd love to scale up as we build up this national movement, national collective. So come to our next meeting. And if people are interested in setting up working groups, that can be the next thing we work on.
Amazing. I see so many other wonderful questions, and I want to get to all of them, but I want to be respectful of everyone's time. So we'll answer these questions and send this Mentimeter back out, and you'll have the answers to your questions, hopefully. But come to our next meeting, we'll also probably address a lot of them there.
Yeah, just really want to reiterate, fill out the form, come to our next meeting next Monday, 8 p.m. We will send the link if you indicate your interest or you RSVP on the form. Send in your questions. We're so excited to meet you. Thank you so much for coming today.